Additional questions that I want to ask somebody coming in with lower back pain is when was the onset and the duration? Was it anything that they think caused it? Were they gardening? Were they lifting anything? Is it getting better? Is it getting worse? But also, we also need to consider some more serious causes. So now we're going to look at some differential diagnoses to see what other things that we need to look out for. Some other causes of back pain that we need to be aware of, and also when we're asking questions to the patients, bearing these things in mind. A urine infection. So if there's a high temperature or maybe pain on urinating, this could indicate a urine infection, in which case antibiotics will be required. For women, check obviously whether it could be period pain. Paget's disease is a bone disease that disrupting normal bone renewal cycle, and this causes the bone to weaken and causes deformities, and this will produce persistent bone pain, numbness, pins and needles, and deformities. So that's why you need to ask what type of pain the patient's having, and if there's any of those symptoms, then they'll need to be referred. Osteoporosis is a condition where the bones weaken and increases the risk of fractures. If the pain is worse on movement, or if it was a sudden severe pain when standing or walking, this could indicate osteoporosis, and it's more common in those aged 50 plus. Ankylosing spondylitis is an inflammatory condition that affects the spine, joints and tendons and causes fatigue, and generally it sort of gradually develops over months and years. So again, any of those symptoms would require a referral. Then osteoarthritis, inflammation of joints, and that tends to be more common in those over the age of 45. And obviously malignancy is always a worry, so particularly if it's a very chronic persistent pain, then we need to think about referring. What can we do to help? We can offer oral analgesics. So first line will be non-steroid or anti-inflammatories as long as there's no contraindications, and second line paracetamol. If preferred, we could offer topical preparations, although the oral preparations will be more effective. If needed, you could use a combination of paracetamol and ibuprofen to help fill in gaps in between doses. So those red flag symptoms or referrals where we need to consider that there might be something more serious going on. Obviously, if it's pain following a major trauma, something like a car accident, it's best that somebody gets referred and has a further investigation. If the pain is worse at rest or better after exercise, that could indicate it's ankylosing spondylitis, so that needs a referral. Weight loss, if it's any unexplained weight loss, so not somebody who's going to the gym and trying to get fit, it's more unexplained weight loss, because then we worry about things like cancer. Sciatica is pain radiating, where there's pain radiating down both or one of the legs, and really there we need to a muscle relaxant needs to be prescribed, and that will need to be done via on prescription, and therefore referral is required. Is there any fever? Could it be related to an infection? We've talked about numbness and tingling before, so that could mean that there's something like a slipped disc or something trapping the sciatic nerve. If you suspect anything like osteoarthritis, rheumatoid arthritis, or infection on gout, then obviously that needs to be referred because it needs further investigation and tests for a proper diagnosis. Common symptoms seen in these conditions are painful joints, swelling, inflammation and stiffness, particularly with rheumatoid arthritis, stiffness first thing in the morning, and also joint deformity. There are lots of complementary therapies around, although studies show very little effectiveness over placebo in both pain relief and joint damage. So now we're going to move on to headache and thinking about common causes of headache. So lots of things can cause headache. It can be stress, it can be medication, hunger, obviously more seriously something like a brain tumour. Certain foods can trigger off headaches, alcohol, dehydration, and also the cold. There are 3 common types of headache, tension, migraine and cluster, and while we're questioning patients using our WAM, we need to try and ascertain what sort of headache that might be. And in addition to that, there are other conditions where headache is a symptom of them, so things like cold and flu, there might be a bleed on the brain or meningitis. So we need to make sure that when we're questioning patients, we're asking questions that can rule out those things and obviously refer when needed. One of those questions we need to typically ask with headaches is where does it hurt? So typically a migraine you'll have pain over one side of the head, especially over the forehead. A tension headache often occurs around the back, although sometimes can go over the top of the head as well, and it's normally dull and throbbing. The location of the headache will give a good indication of what type of headache the patient has and obviously dictate what treatment you want to give. So it's important to go through these with the patient. This table gives a nice summary of different symptoms and what things to look out for different types of headache. So I'll leave you to go have a read through that in your own time. We need to think of other causes of headache so we can decide whether it's safe to treat from the pharmacy or whether the patient needs to be referred. So if it's a headache that often occurs after reading, it will be wise to suggest that they go for an eye test because it could just mean that they need some glasses. Meningitis we covered in the skin lecture, so additional questions you can ask to rule that out is there any neck stiffness, is there any fever, or is there a non-blanching rash? Subarachnoid hemorrhage is a blood vessel in the brain leaks into the brain tissue, and this causes a really sudden severe headache, and it can often occur after strenuous exercise or after sex and needs an urgent referral. Those signs and symptoms that we need to refer on back to the GP or elsewhere. Is there any sensitivity to light, a stiff neck or nausea and vomiting? Because again, that could be linked in with meningitis. The elderly can suffer a headache a few days after a fall, so it's important to find out if there have been any falls or accidents in the previous days. Is the headache improving? So sometimes when you wake up with a severe headache and it gradually improves throughout the day, that could be a sign of increased intracranial pressure, and that obviously needs referral. Cluster headaches, when you get headaches that are increasing in frequency and severity, that can be a sign of a cluster headache, so it would need to be referred also. If you suspect any medication that might be causing the headache, or if they've tried any medication and it's failed, then that will need to be investigated. With general headaches and tension headaches, obviously the first thing you can do is remove the cause. So if somebody's dehydrated, obviously get them to drink more fluids. If they're cold, warm up, or if they're stressed, try and reduce their stress. If we're going to give medication, first line will be non-steroid or anti-inflammatories, as long as there's no contraindications, and second line paracetamol. If needed, you can give a combination product. Alternative preparations are things like pool cooling preparations and menthol preparations, but obviously they will not be as effective as the oral analgesics. Migraine is best treated immediately at the onset of the headache. Some people will get an aura with a migraine, and that's where they have alterations in vision just before an attack, things like flashing lights and zigzag lines. So this can help preempt when to take medication. It's unusual for somebody to present with their first migraine if they're over the age of 40, so if this is the case, then you should refer. First line is simple analgesia. It's important to note that in migraine sometimes the stomach can slow down, which makes it difficult to absorb medication. So using liquid or soluble preparations can help with this. Some more specific products geared towards migraine, we have Migraleave, that contains paracetamol and codeine, but the pink version also contains an antiemetic. So nausea is quite common in migraine, and if that is a problematic symptom for somebody, then the Migraleave pink would be a good option. Sumatriptan is licensed for patients who have had a stable history of migraines, and it works by constricting blood vessels. These products obviously help treat the symptoms of migraine, but if somebody is getting recurrent migraines, then they need to be referred to the GP because they may need some preventative medication which can be prescribed through the GP. So finally, we talk about dental pain. Dental pain can be awful. It's an intense throbbing pain that affects the tooth. It can often spread up the jaw or towards the ear. It's worse when lying down and can disrupt sleep as well. You can get sensitivity to hot and cold food and drink, and the gums become red and shiny and swollen. So we can offer analgesics. First line would be non-steroidal anti-inflammatories if there's no contraindications, and second line paracetamol. Some patients might ask for a combination product containing a mild opioid because the pain is so severe, but make sure that whatever you give them does not prevent them seeing the dentist, because that's going to be the only thing that will help in the long term. They can also have the option of taking both paracetamol and ibuprofen together. There are some topical products we can use as other options, and generally they contain antiseptics or anaesthetics. So antiseptics will help with infection, and the anaesthetics, you just need to warn people that they need to be careful as they won't feel hot and cold food if they're using them. So extra little tips you can give: avoid hot and cold food or drink if that's something that's making the pain worse. Try eating cool, soft foods, obviously on the opposite side to the mouth of where the problem is, and use a soft toothbrush, and avoid flossing temporarily until you get to see the dentist. But the most important thing is they shouldn't delay going to see the dentist, because that will sort out the issue. Hopefully now, after these screencasts, you'll be able to describe the appropriate management of musculoskeletal pain with over-the-counter products, and also give some non-pharmacological interventions where appropriate. Be able to adjust your questioning skills to aid diagnosis and differentiate between different conditions, and also rule out those or seek out those warning signs and refer patients when needed. If you have any questions, please feel free to email me.